My name is Jennifer Keller. I'm the Manager Group Product Development at Canada Life. It's a pleasure for me to be here today, gathering meaningful insights and learnings. As we've all seen through the many points shared today, as well as business headlines, mental health is a key issue affecting Canadians and businesses across the country. Organizations are left wondering how else they can possibly support their teams beyond the solutions they already have in place. Many are looking for unique ways to reach as many employees as they can. In this next presentation, you'll be introduced to an evidence-based service that could be the missing piece for your organization and your mental health strategy. Please join me in welcoming Anna Schiff, Dialogue Chief Product Officer and co-founder, who will walk us through mental health solutions in the workplace and the rise of iCBT.
Thank you so much, Jennifer, and hello again, everybody. It is a pleasure to be here and talking about a topic that I really am passionate about. So I hope you've been enjoying my radio voice because we're here together for the next 15 minutes talking about mental health and about iCBT. So to begin, we spoke a lot today about mental health issues and mental health issues being, I apologize. You know, when you record something live, you have to expect these technical issues being present. So hopefully that's the only one, and I'm gonna continue rolling here. So before I jump in, we talked a lot about mental health issues, how they're on the rise, how the pandemic increased these mental health issues. And before talking about iCBT, the topic I want to talk about first is Dialogue's journey in iCBT. Before we begin, I want to ask a question, and I want to try to have this presentation as interactive as possible. So before we begin, first question, you should see it pop up on your screen. How familiar are you with iCBT? How knowledgeable are you? Are you very knowledgeable? You've deployed it at your companies, or you've used it yourself, somewhat knowledgeable, or not at all. And so you should see the question on your screen, and let's see. Yeah, we're getting some results in, and we're going to close the polls in 3, 2, 1, and I should be able to see some results here. And so it's quite interesting because a lot of the people on the call here have quite a low level of knowledge, and so I'm really excited to share the topic with you. So we spoke about mental health issues being on the rise. They represent the largest percentage of disability, short-term, long-term disabilities, and they have been on the rise over the last 18 years. A lot of our clients and employers have been approaching us and saying, our employees love your service. Please help us with mental health. We see a rise in our short and long-term disabilities, and what can we do? So before launching into a solution, we've spent quite a bit of time researching and trying to understand where do current programs fail today. And so one of those kind of realizations was when we were thinking about the journey of somebody affected by mental health issues. So it all starts by these smaller symptoms that are hard to recognize as small problems. We start talking to our spouse or to people closest to us about the same issues, and we start ruminating about the same things. And then these problems or these thoughts continue to increase, and they turn into more anxiety symptoms or depression symptoms. And a portion of people are never going to seek help and could go into burnout or directly into disability. And then there's another group who will recognize that they need help, and they will try to seek that help. But what ends up happening is often you're trying to look for a therapist. It takes some time between the search and actually starting therapy. Sometimes you run out of the sessions that are allotted to you by your EMP, for example, or sometimes you just can't handle the out-of-pocket anymore. And so that may lead to increased issues and leaves of absences. And so as we were apart on that journey to understand what is the right solution to support our members and our clients' employees in their mental health, there's a few takeaways that we've had, which I wanted to share with you today so that you can think for your own employers or for yourself in terms of supporting your own mental health or the mental health of your employees. And so one of those really interesting takeaways was around treatment type and remission rates. So remission means I have an issue, I have an anxiety or depression issue, and I no longer have it. So for somebody who has, so you're going to see a poll pop up and take a guess. So you'll see that the question is, when somebody engages in monotherapy, so monotherapy is either the usual psychology treatment or medication, what % of people achieve remission? So I'm going to take a look at my poll here and see the results as they're coming in. And so I'm going to wait for a little bit, and we can close the poll in 3, 2, 1. And so for those of you who have answered 50%, that answer is correct. But that also means that only 1 in 2 people who seek one type of help when they're suffering from mental health issues, anxiety, depression, or other, achieve remission. So that means go from having a mental health issue to no longer having it. What about people who combine these two therapies, medical therapy as well as, let's say, talk therapy, cognitive behavioral therapy? What % of people achieve remission then? So you should be seeing that question pop up on your screens. Take a moment to answer. You'll see a few answers there. So we should have these numbers come in now, and they should be rolling in. So we'll just close the poll in 3, 2, 1. And so the remission rate is incredibly higher. So we go from having 1 in 2 people who achieve remission to more than 4 out of 5 people. And so the big takeaway there is having this high-touch, multidisciplinary approach will drive positive outcomes. But what it means for you individually, or for you as an employer for your employees, is how can you give access to this multidisciplinary team, or at least give access to medical care and psychological care that's easy to access and where these two can communicate. Because the outcomes and the remission rates are tremendously increased when you combine the two. The other few points that have been really important when thinking about both our own product at Dialogue, but also for yourselves, is how can you create a proactive outreach in everything that you do to reduce stigma with mental health. Thankfully, with COVID, there has been less and less stigma associated to mental health, and we've been hearing so much about it and how many people have been affected and continue to be affected. And so continuing that conversation and focusing on the groups that are most vulnerable is going to be really, really important. Unlimited treatment, that's something that's very, very important to encourage individuals to go up until remission. And finally, a focus on positive outcomes. So as opposed to focusing on number of sessions, focusing on programs that have remission as their objective for your employees. So we had this great high touch, we call it white glove, high touch, high remission approach. And yet we started looking into iCBT. And so why is iCBT therapy so important? And so this will be my last question for the day for today, but how many people do you think prefer a self-led approach to their mental health as opposed to seeking care externally? And so you'll have 4 choices on the screen, and we will close the polls in 3, 2, 1. And you will see that actually 1 in 4, according to StatsCan, 1 in 4 Canadians prefer managing their own mental health at their own pace. There's this preference for autonomy, there's this preference for privacy. Previously today, we spoke about still stigmatization around mental health. And so there is this absolute need to treat mental health issues either more anonymously, but also starting earlier before they develop and escalate into bigger issues. The second piece is that there's potential for a longer continuity of care. What does this mean? Well, in a typical EAP, there could be a limit of maybe a few sessions, 4 sessions, sometimes 6 sessions. But what happens after is that you no longer have access to that person, the therapist, who was helping you deal with your own mental health. So oftentimes you're left on your own again. What iCBT allows you to do is continue that, have more sessions. Often iCBT solutions provide more coaching sessions. And so it's allowing this ongoing self-led toolkit access that is there to support an individual as they get better and then maybe get a little bit worse and continue on their journey to remission. So what does iCBT include? We've asked the question at the very beginning, what is iCBT? So let's dive into it. First, it's a self-paced, interactive toolkit, and there's a lot of psychoeducation. So there's a lot of people who feel with their heads and first need to understand, how does our brains work? How does our thoughts affect the way we feel? And how does our feelings affect our behaviors and the way our lives are impacted? And so it's really, really interesting because that psychoeducation explains just that. It explains that link, and then it gives us tools to use those thoughts in order to rewrite a story that we're telling ourselves in our head. So it's really, really powerful. It's also available 24/7, whether it's on a mobile platform or web app. So for me personally, I am an iCBT user. I'll talk a little bit about why, but and so I often use it instead of reading my book in the evening. I actually pull up my iCBT solution, and in the evening I read a few pages around psychoeducation. I do a few exercises, and it really allows me to decompress or think through my day before I put away the phone and I go to sleep. iCBT solutions also come in a self-led manner, so really kind of on your own, and some also give the option of having a therapist or a coach leading the sessions. And finally, there are different modules, and these different modules can be more or less relevant depending on a condition. So for example, in Dialogue we have general anxiety, depression, divorce, social anxiety, bereavement, and it's all modules that are highly relevant for what kind of the times we're living for and all the issues that have come out of COVID. And iCBT is an amazing, cost-effective approach to supporting employees with mild to moderate mental health issues. So if you remember that chain of issues kind of starting, if you're able to use, especially in those times, this iCBT to rewire the way your brain works and your thought patterns work, it becomes really, really powerful. So for us, it allowed us to build this really beautiful product where we had the self-led therapy kind of included it with this practitioner-led therapy. And when you can have somebody going from one to another, depending on the needs of an individual. But what's really nice, and we'll talk about that in a minute, is that that's possible in various solutions that are available. So I'm just going to share a personal story because I think it's relevant, and we're talking about parents at home with kids and women and and younger people and diversity and people who feel lonely and isolated and scared of coming back to the office because of COVID. And so it's present, and it was present for me this past summer as Dialogue was on the verge of launching our amazing iCBT solution. I had one child who was out of daycare, another one who was switching daycares. Dialogue was busy as always. Sharif has spoken about our incredible growth. It continued this summer, obviously. And so there was a period of the summer where it just felt like everything was falling apart and breaking down and nothing was really working, and I was at home and I was feeling frustrated with myself for not being fully present. And I was, in meetings thinking about my kids. And it was just, it was this awful kind of feeling of lack of control, which I know so many of us have been feeling. And we've been looking at statistics all day today. And at that time, I started using our iCBT. And it really allowed me to distance myself from myself and take a look and evaluate and rewrite the stories I was telling myself. And it was an amazing tool that allowed me to give myself a hand and support myself as I was going through this more difficult time and trying to manage so many priorities. And so, again, like I said, I'm pretty biased because I really believe in that tool, but it really, really works. So, what do you look for when selecting an iCBT program? So there's a few things, and those were the key elements that, as we thought about Dialogue's iCBT program, we knew worked from our own research, but also from our clients. So first of all, proven effectiveness through randomized controlled trials and peer-reviewed research. Why is that important? Again, thinking about remission. You want a solution that is proven to bring patients, individuals to remission, and not just because the provider said so, but because there's external research to validate it. It has to be easily accessible through the same platform as other employee benefits, and we've heard conversations about that. Desjardins has spoken about it, the importance of putting things together. And why is it important? Because that way you allow for the seamless transition between practitioner-led therapy when necessary and the self-guided therapy. What you also want in your iCBT is an option between having a fully autonomous solution or a coach-supported one. And finally, it's really important that it's 100% free to employees with no out-of-pocket payments. And the reason that's important is because we don't want employees to be stopped by having to make a payment, even though it's reimbursed afterwards. So we decided not to build our own iCBT from scratch, but we went out and we looked at pretty much every single iCBT solution in the world, and we landed on an amazing acquisition of eHub Health. Sharif has spoken about it in his opening words, but it's a company that was spun off of the Australian National University. They have the team have over 20 years of experience, have helped more than 1.5 million individuals, and the amount of randomized controlled trials and its effectiveness have been huge. And I personally consider myself so lucky to be working with Dr. Kylie Bennett on almost a daily basis. And it's been a huge addition to Dialogue and the way we think about our iCBT. And so you see it all in one platform. You log in, you go to stress and well-being. All the mental health services are centralized in one place. And within a few minutes, you complete a really quick questionnaire, and then you're able to access this clinically proven iCBT around, information, cognitive behavioral therapy, relaxation, exercise, and so many more tools to help ourselves, to help your employees. And so, if you're interested, you can reach out, you can put your email, you can click the banner below, and you can start the conversation. What are the self-help tools that you give yourself or you give to your employees to help with that mental health? How do you accompany someone who may be starting on that journey or may already be on that journey? How do you allow them to help themselves when they are just looking for the tools? So I hope that gives you some ideas. Thanks a lot.